You're gonna get a second video. Sorry, I had a call that I could not ignore. So anywho, where did we leave off? Hypernatremia. So then you're going to worry about heat stroke, or that can be caused by heat stroke because you're sweating all of that out, and then diabetes because you're diuresing a lot. Signs and symptoms: dry mouth, and if you're thirsty, you're already dehydrated. So drink your water. Swollen tongue and some neuro changes. Treatment: restrict sodium, dilute client with fluids. Hold on. Oh, yeah, so lots of fluids because that makes your sodium go down. Daily weights, INO, and lab work. For hyponatremia, you have too much water, not enough sodium. Causes drinking H2 for fluid replacement from fluid and or from vomiting and sweating. So what you should be drinking is like Gatorade or something with electrolyte that only replaces the water, but it dilutes the blood, so you're not getting those electrolytes that you need. And then psychogenic polydipsia loves to drink water. That's somebody who's really super thirsty all the time and they just drink water like clinically crazy. Sorry, well, not crazy. I would never say that to a patient. Don't mark me points for that. Okay, so we're gonna go to potassium now. Potassium, you're gonna worry about your heart. So anything hyper or hypokalemia, you're gonna be worried about arrhythmias, life-threatening arrhythmias. So get that under control. Hyperkalemia, it's from kidney trouble, or maybe if you're on a loop diuretic that's making you retain too much potassium, you gotta check out for that. Signs and symptoms are going to be muscle twitching, then proceeds to muscle weakness, and then flaccid paralyzed. And then treatment's going to be dialysis because your kidneys aren't working right, so let's get that fixed. If it's for your kidneys, if your kidneys are broken, sorry. Calcium gluconate, that decreases arrhythmias, and glucose and insulin if it's due to your diabetes. And then for hypokalemia, causes could be vomiting, suction from the NG, because you have a lot of potassium in the stomach, so if you have NG suction, you're going to need that taken out. Diuretics, or you're just not eating, it's going to start with muscle cramps to muscle weakness and then to arrhythmias. Treatments: give them some potassium, give them potassium sparing diuretics, and then eat more potassium. So, and then one of the major problems with giving potassium orally is GI upset, so you're gonna be careful with giving that, and then assess urinary output before and during IV potassium. And then let me pause you, and then we're gonna go to burns. Okay, here we are for burns. One thing about the burns is we're worried about a shock, a dehydration, because all of your fluid that's supposed to be in the vascular space is leaving, seeping out into the tissue. So we're worried about that, and we're worried about shock. And the majority of that first presents, like if you're worried about shock, that's going to mostly be within the first 24 hours. And they're going to have an increased pulse because, anytime you're in a fluid volume deficit, you're going to go have an increased pulse because your heart is trying to pump all what's little left fluid around super fast. And so we got an increased pulse, but it's going to be thready. And most treatment for the burns is stop the burning process. So wrap the client in a blanket to stop the burning process if you're there for that. And you could have put cool water on it, no more than for 10 minutes, and then a blanket to help hold the body's heat in. So if you're on the scene and all you have, wrap it up in a blanket to keep it, to keep the whole heat in and keep germs out. And then you're going to want to remove any jewelry because you're worried about edema, and metal gets hot, so you don't want to burn them some more. And then remove any non-adherent clothing and cover the burns with a clean, dry cloth. When we're worried about inhalations, that's the number one cause of death is inhalation injury for when it comes to burns and stuff. And then these injuries usually occurred by inhaling carbon monoxide or hydrogen cyanide. So that's more about carbon monoxide poisoning, which is important. It's in the burn section, but I kind of want to talk more about injuries and the indication of inhalation injury. So it's going to be the cinched nose hair, cinched facial hair, set, like the black stuff on the face, coughing up secretions with dark specks in it, so that's like the smoke and inhalation, difficulty swallowing, wheezing, blisters found on the back of the throat, hoarseness, and stridor. And hold on, sorry my friend, try and remember what I wanted to write. I highlighted it. So for wounds, wound care, we are going to use, there's kind of different debridements you could use, enzymic debridement agents, and that could be used to remove necrotic dead tissue. Hydrotherapy could use to debride. And the most important thing when handling your wound care patients is their pain management. So make sure that they're their pain is well managed, and that you're keeping things sterile and clean while doing it. And then for their nutrition, you're going to want to make sure they're eating more calories, lots of protein and vitamin C, and be monitoring their albumin levels, because we're worried about dehydration and their protein going down and losing that protein. So, and then, so we're worried also about circulation, so make sure the client has if it has edema, make sure it's lifted above the heart, and make sure you're doing your 5-piece checks with that as well, and make sure you're doing vascular checks on any of the affected extremities. And I think that's all I'm gonna say over for burns right now, because I felt like my video is way too long. So just make sure you're worried, again, keeping the wounds clean, not trying to pass on infection. If it has eschar, the dead tissue, you're going to want to remove it, and because bacteria grows in it and you don't want that to get messed up. And I think, yep, that's all I want to say. Okay.